Professor Nancy Fontaine, this must be such an important day, such an important result for you and your team.
Michael, thank you. Yes, you remember the fateful day on October the 30th when I spoke to the local population, and it felt devastating for both the staff and me personally, feeling that we'd let our local community down. Today I'm standing and speaking to people around us and feel really proud of the staff and what the hospital has delivered to improve our services to such a great degree in one inspection. So people told me, you will never get out of special measures, you will never exit special measures in one inspection, and we have done that, and that is testament to the grit and determination of every service and of every individual at PAH. And in particular, end of life was rated inadequate, and you can now see from the matrix we have gone straight to good, and critical care was rated inadequate in 2016, and we've gone straight to good. And the emergency department, you know how busy our emergency department is, we are no longer an inadequate department, and so we've moved to requires improvement, and I think that is success. And also the rating for us gives us a real hunger to quickly get to good overall, and I think the well-led rating of good sends a real message out to all of the local community that actually we have strong governance, strong processes, and the leadership teams at every level really want to make a difference for patients. And it is patients and staff together who have delivered these improvements.
Because to be fair, if we go back some number of months, I think we probably did ask you the football manager question, do you want to consider your position? Were you, I mean, and obviously your answer was no, but did you seriously think, how did you feel? Did you feel, I don't know, I can do this?
No, I felt devastated, but you would know that that is ammunition for me and fuel for me to make sure that we deliver the improvements. The job of a chief nurse and deputy chief executive is to facilitate, coach and support all of the staff to have the autonomy to deliver quality improvements, and that's what we did. And if it meant that I personally worked alongside them and saw them every 3 weeks and worked through every process with them to assure that we would get a consistent outcome for better for patients, then that's what it took. And indeed, we used an appreciative inquiry. It's very easy to do a top-down approach into quality improvement, but this came from all of the staff and patients together, and it was giving them the tools and the recognition to do that. And I think that's testament to the real community of Harlow at PAH, because the staff have wanted to demonstrate to every regulator in the outside world and all our patients and families, we deliver great care.
And has this been a day-by-day plan since you got space? Day-by-day, week-by-week? What's been the structure?
So I've never looked back, and my advice to any chief nurse or any director in a struggling, challenged organisation is accept the report and then immediately work with your teams alongside them, and that you have your focus, your goals, and you work with patients and families. They are your best critical friends, but also they're the ones that can help you with audits. They're the ones that if you listen to the feedback, you make the changes. And that's what we've done. I think one of the real successes at PAH is we're open to feedback from staff as well as patients, and transparent, so we've shared everything. And I think the other aspect that's really different is that we've worked so hard on staff empowerment and staff engagement. We have regular briefings, staff feel that they can raise issues. Certainly for nursing, midwifery and allied health professionals, that's always been there, but it was important that that was opened out to all members of staff, whether they could talk to our chief executive. We have weekly briefings where any member of staff can come to, they can ask any question.
Is that true? Can they ask any questions? Sometimes senior managers say that, and then they get somebody gets pulled around the site, and I shouldn't ask that if I were you. If you want,
So every week at 8:30 on a Tuesday, and you're more than welcome to join us. We have a staff briefing, and anyone can come. In fact, it's in a public area, so patients and families could actually ask the question if they wanted to, and they haven't yet. We have a wonderful relationship with our estates and facilities, and without my wonderful colleague who, if he didn't ask me a question that was difficult around estates every week, I would feel at a loss. I'm not going to mention him, but I miss his challenging questions when he's on holiday. But actually, the staff have recorded to the CQC. They feel they can ask us anything. That all of the leadership teams are visible and approachable, and are also supporting any changes. And I think that isn't just the top leadership team. That's every leadership team of every service. So if they know that they can come to you, then they also feel empowered to make the changes.
You've got a group of people around you, and I'd like everybody to have their minute, or 6. Would people like to introduce themselves and tell me how they feel about the report and what they feel they or their department has contributed to this success?
Okay, my name's Anna Morby. I'm ward manager and senior sister on Penn Ward, which is a general surgical ward. I've been in this present post for nearly 25 years, so I've seen a lot of changes. I have to say, back in 2016, it was an enormous, devastating blow for everybody when the report came out. But very quickly, it was really obvious that there was a really big focus and drive and determination to change. And we've been very much empowered and incorporated along the way to do that. Changes have been very much driven by nursing, so there's been an enormous change in quality of care. And we don't accept pressure ulcers, we don't accept falls as the norm, and we've maintained an excellent track record with that. One of our really big priorities regarding quality of care is end-of-life care, which we're all incredibly passionate about. And we strive at every point of the journey along the way to involve relatives, families, involve them in the care, to form really good relationships as quickly as we can, because we feel that's really important to that care, and to listen to them and to work with them to provide individualised care. And that's something that we're all really, really passionate about. And I think there's been enormous changes in the quality of care that we provide.
Has it meant doing extra work? Has this long period?
It has. We've had very challenging times with staffing, etc. But everybody has supported each other and worked together. And it feels we're in a different place now.
Thank you very much. Jill, tell us a little bit about your role.
My name's Jill Robertson. I'm lead nurse for the Specialist Palliative and End-of-Life Care team. I've worked within the hospital for 22 years. So again, I've seen lots of changes, and again, like everybody, that 2016 time was really bad. But as Professor Fontaine says, we dealt with it. We looked at what we needed to do. We had good plans. We had good people to lead us, and that was very important. We had good direction of where we had to go. I think the CQC gave us a lot of direction in that report, which they perhaps hadn't done before. So I think that was a useful thing to know what we had to do to achieve what we wanted to achieve. The types of thing we've done, that we've built on more than done, is the education we provide here. Certainly within end-of-life care is quite unique. We use the simulation suite, which is we help educate, and it's not just the doctors and nurses, it's all health professionals, and we extend that to our stakeholders outside as well, the community and hospices locally as well. So we use the simulation suite to mimic end-of-life scenarios. So what we want to do with our education is improve and give confidence to clinicians to make decisions and to discuss with families and patients especially what is happening to them in an open and honest way, so that patient can make their decision as well as to what they want. To help that, we've also developed ceiling of treatment. So there's a robust approach to that we can, that sort of aids the clinicians making those decisions and aids the clinicians involving the patients and families. And that's recorded when people are designated as end-of-life care. So when we feel they're dying, maybe in the next 48 hours or imminently, we ensure that they're seen by the right people. We ensure that that's discussed with them where they want to be. If they want to be at home, then that's facilitated as quick as possible. If it's a hospice bed, we try and facilitate that, a care home. if they want to be in the hospital, then we've got this wonderful bespoke ward, Gibberd Ward, that was designed by nurses and also designed with feedback from families as to how it should be. And we've got 6 side rooms here that we ensuite side rooms that families are able to stay with their loved one as much as they can. We've had pets in. We've had people die with their dog on the end of the bed. It's a very open place. It's a very calm environment as much as it can be. And although it's not home for them, we try and make it as much as home as possible. So those are the types of things that we want to change, and we have changed. And I think we couldn't have done that without the support of the whole hospital. We wanted to make end of life everyone's business, and we've achieved that. We have the amazing support from the domestics, from the porters. They give as much care as anyone else does in the trust. But without the executive team, we wouldn't have achieved that.
Great, thank you. Do we want to do other people? Do we want to go, or do we?
So, as part of the improvements around end of life, I was contacted by Liz Pryor regarding working alongside the Anne Robson Trust, and this is in order that we could start an innovation, a fantastic innovation called the Butterfly Volunteers, and I'm going to hand over to Liz to talk. It's really a fantastic and phenomenal innovation that makes a quantum of difference to patients and families' lives.
Thank you, Nancy. I'm Liz Pryor. I with Joanna, my colleague, we have recently set up a charity. We're about to be a registered charity any minute now, I hope, that implements teams of volunteers in acute hospitals. I worked previously for East and North Hearts Trust, and I set up a team of these volunteers there while I was working for the Director of Nursing, and it made such a huge difference to so many people that I quickly realised that actually this is what I wanted to do. I do this work because my mum, Anne Robson, was very poorly treated in hospital in Suffolk, unfortunately 8 years ago, and died as a consequence of that. A few hours after she was discharged to her care home. And so that was the springboard really for me to get involved in this work. I don't have a clinical background. I'm not a nurse. Jo, on the other hand, is. So we balance well together. And what we're doing at the moment is trying to create a supportive team of people to support the nursing staff, to support the senior management team, to support families and patients at a time that's so frightening and so difficult. Also, the society is growing exponentially, and lots and lots of elderly people are in hospital unsupported, and families are not necessarily. It's very difficult for nursing staff to sit for hours on end with somebody. They just don't have the time. They've got so many other patients to look after. So we're here. The work that we do really affects everybody. So it will affect the patient and their family, because hopefully they'll feel supported, even by just being made a cup of tea. It's just somebody there to support them, to hold their hand, to put their arm around them, to make them a cup of tea, and to sit with the patient if they want a break, to assure them that there'll be somebody else later if they want. If they can't come in tomorrow afternoon, there will be a volunteer that's available to come and sit with somebody. So it's a very simple scheme, but it would be great if we could make this scheme as good as it possibly can be. Lynn is one of our volunteers. She does amazing work.
Tell me about your work, Lynn.
My name's Lynn Murray. I'm Ward and Committee Secretary and Executive Assistant, working alongside Nancy and her team. So a non-clinical role. I saw all the emails that came out about become a butterfly volunteer, read them and thought I'd quite like to get involved, but your busy day job, etc., etc. But Nancy persuaded me to participate in the training, and I can honestly say I've never looked back. I found it quite sad when I realised that people were dying here alone, without anybody with them, and I was kind of clocking off at 5 p.m. when I'd done my day job, and I thought, I've got a couple of hours, I'd love to sit with someone. and I've found it really rewarding, and I think it truly makes a difference to patients and their families.
Do you not find it tough?
I found my first shift quite tough because on my first shift I sat with a lady for a couple of hours, and towards the end of that shift she did die. But on the flip side of that is the fact that she actually had someone with her at the end, and if I or any of the other volunteers hadn't been there, she would have died on her own.
I just want to bring it to a conclusion, this particular piece. So,
Can I say that I coordinate the whole team on a day-to-day basis, and I remember that first shift when Lynn came back. She was quite shocked, and I was willing to give a lot of support at that point because we support all our volunteers, but I didn't need to. The ward had already done all that, and that's what the team here at PAH do. I have a background in nursing. I have nursed in many different hospitals throughout the country, and I would say that the support that the whole team and the way it all works is beautiful and joined up, and that is quite a change from some of the hospitals I've worked at. And when Lynn came back, she'd have been given a cup of tea, people had talked to her, it had all been quiet, it had all been really well managed, and that is just a beautiful thing to see.
so in conclusion, that tribute there about the team, that beautiful, that joined up, that's quite a tribute, isn't it?
I do see it as a tribute, but I want the patients and relatives to realise that we can only get even more improved with their help, and that connection we have with patients is something special, and our regulators said that what we do here for patient and involvement is second to none. It's cutting edge, and I want that to carry on because I know that we have exited special measures and we've had great accolades, but it doesn't stop here, Michael. We can't stop. We have to prove to everyone else we'll get to outstanding, to good and outstanding. We want to work towards that new campus in 2025 with integrated primary care, community care, and acute trust. That's better for the local population. And it's important as well, we've carried on despite being in special measures. We've managed to retain our top 10 position for infection control, the cancer treatment access for all of our patients. We haven't dropped out of the top 10 in 2 years. That our access to surgery, we have led that for 2 years. And our cancer experience is best in the whole of the Eastern region. And finally, at last, you asked me how I know things are going to get better, is that our staff have said in the National Staff Survey that they like working here and that they feel that they're listened to. So we've actually got the data now to support it, everything that everyone has been telling us, that they want to work here. But I'm really always, as you know, looking to attract people who want to work alongside me in research to improve patient experience and to make our clinical practices even better at Harlow.
Professor Nancy Fontaine, everybody here, thank you very much.